So, you are thinking of taking care of a child that is fed by tube, also known as Gavage feeding. This video will show you that providing Gavage feeding can be done in any daycare or home care setting in a safe and easy manner. We will show you that this feeding technique is not sterile. It can be easily learned and it will become part of the routine care that you provide for this child. This is the equipment you will need to set up a Gavage feeding. Parents will provide you with this equipment. A Gavage pump, also known as a kangaroo pump, a Gavage bag and tubing, and an extension tubing that will connect to the child's button. You will also need the child's formula, which the parents will. First, wash your hands. Then pour the formula into the bag. Now you will need to insert the Gavage bag and tube into the pump. This is done like so. Now you will need to connect the Gavage tubing to the extension and then connect the extension to the child's button. This is done by aligning the two black lines together, pushing down, and rotating the extension. There is no limitations on the child's movements as a result of this button. They can crawl, they can swim, they can play like any other child. This is the button. It is secured into the stomach with a balloon. This is how the balloon is inflated. The balloon is only inflated by the parents or the nurse. Connecting the extension tubing to the button is done by aligning the two black lines together, pushing down, and rotating the extension. There is no other special care for a child receiving a Gavage feeding. Once you are comfortable with setting up the feeding, the child will be no different than any other child you are taking care of. In the highly unlikely event that the button falls out, simply call the parents of the child and they will come to put it back in, or take the necessary steps. The parents will explain a clear plan of who to call and what to do in this unlikely event. The parents of the child will teach you how to use the equipment, the technique of attaching and removing the extension tubing, the preparation of the feed and how to use the feeding pump, and how to keep the equipment clean. Should you have any questions, the parents should be the first resource to call to troubleshoot a problem. Thank you so much for your time. This video was brought to you by the Neonatal Follow-Up Clinic at the Montreal Children's Hospital.